Did you know, for instance, that almost 500 million people globally suffer from hepatitis? Of this number, did you know that almost 1.4 million die every year globally? And if you break that down so that you will understand, you will realize that almost 4,000 people die on a daily basis from hepatitis and hepatitis-related ailments. Indeed, hepatitis is the silent killer. However, there is some good news. The good news here is that unlike COVID, hepatitis does have vaccines, though not all. Unlike COVID, hepatitis has treatment, even though not all results in permanent cure. What I'm trying to say is there is succor, but the major problem is that a lot of people are not even aware. And that forms the first leg of the 4 legs that hepatitis 0 stands on. The essence for us is to get talking about it. And that's actually what informed the partnership with the NOA and the relationship that we're building with NASCAP, so that more and more people can get to know about it. It is so bad that when you talk to 10 people, 8 of them will have something to say about hepatitis. Unfortunately, it will be something bad. Some of them will tell you, oh yes, I know hepatitis, it killed my brother's sister's wife, or it killed my house help, or I couldn't take my house help because she had hepatitis, or my in-law has hepatitis. I mean, you will have 8 terrible stories from 10 people. Now, when you move forward further and say, okay, do you know what hepatitis truly is? They will say no. Do you know the symptoms of hepatitis? They will say no. Do you know what causes hepatitis? They will say no. Do you know what you need to do to prevent yourself from contracting hepatitis? They will say no. And that forms the reason, the basis for creating a lot of awareness, so that more people will get to know what to do, how to spot it, and how to avoid it. Now, if you're lucky to be negative for C, then you just decide to stay careful, avoid unprotected sex, avoid sharing needles and syringes, avoid whatever will cause exchange of body fluids like contact sports, especially if the other person has not been tested. Avoid using sharp objects like the way they use razors for cutting belu in those days, or even giving those tribal marks. Now, if it's B, it's even better, because you just take 3 doses of vaccines 1 month apart, and you're covered for up to 30 years. So why would anybody not want to know their status? To this extent, we've gone ahead to create a lot of awareness for not just the World Hepatitis Day, which is tomorrow, Tuesday, but to share with you what we intend to achieve throughout this week, because what we will have is a full hepatitis 0 week. And we're starting today with this media briefing, because you are extremely important in carrying this message out there. The public needs to know. We can say a lot of things, we can make all the noise we want to make more. If you do not carry these messages, the community will not understand. So we're relying so much on you to help push this message out there. A friend of mine will call it the gospel according to Saint Hepatitis. Later today in the afternoon, we'll have a Zoom. Well, this is actually the only physical activity that we'll be having. All the other activities are online for obvious reasons. We cannot continue to expose everybody like this. In addition to the free screening and vaccination that we'll be having here for everybody that comes in here free throughout this week. But besides the vaccination and screening, this is the only exercise that's happening physically.
That's why we're asking everybody to go out and get a test. That is the surest way to know whether or not you have an infection. The second question relates to testing, and maybe I will put it this way. Compulsory testing, I think that's the way that we classify it, as is done by some religious groups and in certain settings. While it is important for people to know their status, especially when you're going into a marriage relationship, it's part of the issues around disclosure. right? You may not be able to constrain people to take a test. Some of the same principles we apply for HIV, and that's the decision that individuals have to make whether or not they want to take a test. So there are also some human rights issues that are related, and we may not be able to make it a compulsory thing for anybody. We only have to appeal to people and tell them why it's important and allow them to make a voluntary decision. Thank you.
They know, for instance, you can actually prevent the pregnant mother from transmitting the hepatitis to the baby. It's actually preventable. In fact, same thing can be done for rape cases. Once is within 24 to 48 hours. Now, if they already know, then they will look for other ways. If they must get married and will need to continue to have protected sex, then they know they can continue to have protected sex. And when they don't have to, they know what to do for. I mean, there are obvious avenues. To the specific question, I said to add to what Dr. Akudo said. To the specific question on COVID, I think because there's not been a lot of awareness, it is truly a silent killer. The documents are there both locally and from WHO globally. But then there's lack of awareness. People do not even know. And that's the reason why we're actually kickstarting the 2020 Hepatitis Zero week with this media briefing, so that you can help move the message to the community. And that's what NOA has been doing with us. You had Madame say the van goes around talking about different things, including hepatitis, and it has hepatitis stickers and messages all around. You see our building here, it's not an hepatitis building, but I mean, we have some Did You Know series there, and we continue to do the bit we can. Madam has been doing everything from NASCAP to support. There is a global press conference tomorrow. It all starts from talking. We all need to start talking about it. When we begin to talk about it, then people will get to know their status, meaning they will get tested. Once they get tested, then they can either go for vaccination or treatment. I think it's as simple as that.
With which the National Orientation Agency is taking this campaign. We have 3 vehicles that are branded. And so no matter where we go to, whatever message we are sending, even as we are going out for COVID-19 campaigns, we still have your stickers on our van. That's to show that the agency, under the leadership of Dr. Garba Abari, is taking this message very seriously, because quite a number of Nigerians are ignorant, and those who are not, as usual, believe that it's not my business, it will not happen to me, until something happens and they say this is what has killed the person. Then we pick up. But we should not die before we believe. We should be believing and doing the right thing. So our messaging, and even today to Nigerians, is to listen to the protocol concerning hepatitis zero and do it, so it becomes a zero disease in Nigeria. We are glad to be here. The Director General said to let you know that anytime there's a program, if he's not here, he will send somebody. And I'm sure over time we have done that. The last time he also came to the office to give the second and third doses of the vaccine, we were also there. And so it will continue until we are able to say to ourselves that it can no longer do us any harm. Thank you for having us.